Good day. Welcome to the Cory Morgan Show. As again, I am Cory Morgan, and this is my weekly production here with the Western Standard. We cover political issues, social issues, just whatever's kind of hitting the news or whatever's getting under a burr in my saddle at any given time, and I get it out of my system. We also have interesting guests, news updates, and all that good stuff. This show is running live when we record it anyways, and I know some of you are picking up in a recorded setting as well. So by all means, if you're watching the live version, guys, throw those comments in there. I appreciate them. I see them all. I won't necessarily read them all out, but I do like seeing them. And hey, feel free to chat with each other on things as well. Just, I know it's easier said than done sometimes, guys, but let's keep it civil there. So good to see you checking in there, Paradoxy Night Shift, and somebody talking about my haircut and no tie. Yes, I got out of wearing a tie around here. The haircut, I don't know, I'm a little mixed on it, but I'm never been much of a fashion maven. I'm too hung up on the issues. So in a little while, I'm going to have my guest for today is Dr. Dean Vause of the Alberta Adolescent Recovery Centre. I've really been looking forward to this. I've covered addiction issues, treatment issues a lot over the last few years. I've had a direct experience. In some ways, I am a recovering alcoholic. I've always been open about that. It doesn't make me an expert in these issues, but it does make me understand and certainly empathize when you've got something that's taking you in a direction you don't really want to go, a self-destructive sort of path, and how I understand how important it is to have support and help to get yourself out of that. So talking to somebody who works and specializes in helping people get out of that awful cycle of addiction is going to be something very good to look forward to, because we've had that discussion hitting the Alberta election lately. Premier Danielle Smith has announced what she's kind of called a compassionate intervention, and possibly examining having compelled treatment or bringing people in to treatment versus, I think, some of the other options such as jail or other areas. Just we've really got to try and get this under grips. So it'll be a really good conversation. So I'm going to stay on that theme a little bit in some of the politics and the Alberta election with one of the things that's got me wound up today. So again, it's regarding Danielle Smith. So last weekend, we had some healthcare statistics quietly released with a little fanfare. When they drop it on the weekend, they're not really looking for people to pay much attention to it. And today, legacy media, of course, has already forgotten those statistics, and it's a pity, because the dramatic improvement in waiting times for ambulances due to new policies implemented by the UCP should be making headlines right now. As recently as last fall, Albertans were dying, literally dying, while waiting for ambulance services. One of the worst cases was an elderly woman who bled out after a dog attack just minutes away from Calgary's largest hospital. She had to wait 40 minutes for an ambulance to arrive. We had red alert periods in Calgary and Edmonton where there were no ambulances available at all. It was commonplace. Meanwhile, rural ambulances would get pulled into urban centers, and then rural firefighters and police officers had to take on paramedic roles as they desperately tried to transport injured people to hospitals. Now, paramedics and citizens have been raising concerns about this issue for years. We've had multiple governments paying lip service to the problem, but none have done really anything aside from tossing more money at the issue, and it didn't have much effect. Until now. Danielle Smith raised the EMS crisis as an issue while running for the UCP leadership, and she promised to act upon it when she became premier. Well, last December, the Smith government announced changes that were going to be made to improve EMS response times. To begin with, vans were going to be equipped and contracted for use in non-emergency transfers of patients. Ambulances and trained paramedic teams have been doing that for up to 75 trips a day when they weren't really in need of emergency services, these transports. Meanwhile, of course, emergencies are happening. The NDP predictably responded with hysterics and accused Smith of wanting to harm patients by using Ubers instead of ambulances. In those cases, despite the hyperbole from the NDP, Uber actually is often a more appropriate option than a fully equipped ambulance for a non-emergency patient transfer. Smith also vowed to increase physicians, nurses, and other resources for triage in emergency rooms to reduce the time paramedics are stuck doing hallway care because the hospitals weren't admitting the patients being dropped off. And we've had at times as many as 20 ambulances piled up outside of hospitals as paramedics can't find hospital staff willing to take the patients. NDP health critic David Shepherd panned the plan, saying, "I can't see this announcement being anything but an incredible disappointment to Alberta's paramedics and frontline healthcare workers." The UCP government also started to set timelines for emergency rooms to take patients. Then again, the NDP accused the government of forcing paramedics to dump and run with patients, which was utterly untrue. Hospitals were expected to admit patients from ambulances in less than 40 minutes. That's not an unreasonable request. So now it's been a few months, and the numbers are in, and they look fantastic. In November of 2022, so just last November, Calgary was in a state of EMS red alert for 4.2 hours. In 1 month, 4.2 hours, the city of Calgary, 1.4 million people, had no ambulances. Last April, that number was down to 4 minutes. 4 minutes, that was it. That's quite a reduction. Ambulance response times last November, they averaged 22 minutes in urban areas and 64 minutes in rural zones. That's a pretty long time if you're in serious condition. Well, last April, those response times had dropped to 12 minutes in urban areas and 40 in rural areas. This is life-saving, folks. And the silence on this success is deafening. There's no doubt about this. Lives are going to be saved thanks to the changes made by the UCP to EMS policies. We should be shouting this from the rooftops and examining more common sense approaches to healthcare bottlenecks in the system. Unfortunately, partisan loathing of Danielle Smith has rendered the establishment and legacy media outlets incapable of crediting Smith with doing something right. The bloated Alberta Health Services bureaucracy has created an inefficient healthcare system incapable of embracing change or innovation in care. And in firing the inept board of the health services and forcing common sense solutions to the problems, Smith's actually managed to bring about quick success with a crisis that hadn't seen improvement in over a decade. Now Smith is taking a strong, no-nonsense approach with taking on the addiction epidemic as well. She's surrounding herself with treatment specialists and recovered addicts rather than listening to the usual suspects in the establishment who insist on further enablement policies. Enablement policies for addicts have failed, and they're failing throughout North America. Overdoses are continuing to climb while the number of addicted people keeps growing. We need results-based policy rather than aspirational ideological pap. Smith seems to be willing to cut through the BS and impose policies that work rather than pursuing policies that feel good. If Smith loses the election due to an establishment that refuses to accept positive changes, the healthcare system and the addicts in need of treatment will all suffer for it. If we can't credit a success, we're never going to see more of it. And that's what's kind of got me wound up, guys. I mean, really, what I'd like to almost see even is have some NDP supporters or just former conservatives who can't stand Premier Smith saying, I can't stand her, I still won't vote for her, but hey, she did something right and we need more of that. So we'll embrace that policy. I mean, you can give a backhanded compliment at least, but don't just suppress this. Don't ignore this. It's so rare when we see policy successes in anything, it seems, with government. And this was really not a long, and that was the difference this time. She didn't go into saying, we're going to strike a committee and listen to some results and talk and discuss it for the next 2 years. She didn't say we're going to have another commission or have another study. She said, here's the problem, here's a few solutions, and here's what we're going to do. She didn't dither and mess around. And now we're seeing a quick positive outcome from it. Hey, if it had been a failure, we would certainly be hearing a lot about it. All I want to see is results-based policies. I honestly will vote for who will get me results. If Smith's policies fail, I wouldn't vote for Smith. If Rachel Notley, I'm not an NDP fan, but if she's putting forth policies that work on things like that, healthcare or addiction and saving lives, that's the sort of thing that's going to win my vote. But we just don't seem to allow ourselves to give credit to somebody else when they get something right. And that's not good for any of us. We're not going to get more positive solutions. We don't encourage our politicians to get positive things done. And it's also an indication of just how slanted, unfortunately, our establishment and legacy media have gotten. I mean, they did report that initial story, and it was a very good article. It was in the Herald. I'll give credit where that's due. But then that's all you heard about it. Like, this should be a big deal, and it's already being forgotten. Not good. Not good for any of us. Let's see where we're going to go here. I'm going to talk about another thing. This is something that disturbed me a little bit. I saw some poll numbers that came out in Canada, across Canada. I had a guest on. He was one of the first proponents. He was a lawyer from way back in the days with Sue Rodriguez, for folks who remember that. That was assisted suicide. It was a big issue. Now we've got this medical assistance in dying, and is what we call it, MAID. And, it's where you're going to have medical intervention to help somebody pass away if they've, chosen to. And I think a lot of people don't have a problem with that as long as the person is, I guess, terminal in their right mind and makes that decision, a personal decision that may be, that possibly that's something they can offer. But it's already getting far and beyond, I think, what anybody reasonable would expect of it. I mean, we were talking about using medical assistance in death for people with nothing aside from a mental health issue. Well, hang on a minute. That's not somebody who's in their right mind. This is not somebody necessarily making a rational decision. And this is problematic. And when I spoke with that lawyer who talked to us, he says, yes, when he was out there with Sven Robinson and talking about Sue Rodriguez, who had a terminal physiological problem going on, a painful one, debilitating one. That's what they were looking at, not somebody who's suffering from chronic depression or some of those, again, very debilitating conditions, absolutely. But these are not people who are in a good position to choose whether they want to live or die. I listened to one bizarre statement from a federal cabinet minister when he said, don't worry, we will never apply this. We'll never allow medical assistance in dying to somebody who's suicidal. Wait a minute. Think about that for a second. We won't give somebody the choice to choose to end their life if they plan to choose to end their life. Talk about pure liberal baffle gab. So I'm not talking about throwing out the whole medical assistance dying. I'm just saying we got to be careful with it. Now, this poll, getting back to it, this is from a research company poll. 1/3 of Canadians apparently are fine with prescribing assisted suicide for no other reason than the fact that the patient is poor or homeless. Folks, really? Really? I mean, so is that where we've come to? When you see it's so hopeless because somebody's poor or homeless that we're just better off just to let them end it all rather than try to pursue recovery and bring them back up on their feet and get them rolling. 1/3 of Canadians thought that was an acceptable path for people in that condition. I hope this poll's an outlier. I hope this poll is wrong. I hope it was phrased poorly to the people who answered it, because that's horrible, guys. 1/3 of us thinking, hey, well, gee, that guy's homeless. He's in such terrible condition and everything, and he looks so miserable. Yeah, you know what? We'll offer you a way out. Here you go. We're not going to help you get on your feet, get a job, get a home, get your mental health issues in order, but hey, we can take you to your grave. That's really 1/3 of people think that's all right. I sometimes weep for society. I'm crabby, I'm negative on here a lot, but I try to maintain some degree of positivity. I mean, I guess 2/3 of Canadians realize that, no, this is not a good idea, but I just would have thought that'd be the kind of poll question where, you're talking 5%, 10% maybe, and you're always going to get some people calling for ridiculous things, but 1/3. Again, where have we come to where we just rather let people die than try to things get better? So I'm looking at some of the comments here, and it'll help bring things up. Where we're talking about when people think things are beyond hope, they aren't. And there's fantastic success stories all over the place. There are. So, I mean, medically assisted death for anything other than a physiological terminal condition is not a success. That's a failure. That's an avoidance. That's a horrific approach to something. I see commenter Kiera Brady. I could be mispronouncing that. I'm brutalized people's names on this show on a regular basis. Saying compassionate intervention without question saved my son at 17 when we almost lost him. I'm so grateful that at last someone has finally had the courage to address this issue. Kids are dying. And they are dying. They're dying a lot. And they're everybody's kids. Don't just think just because you're doing all right that it can't happen to you or it can't happen to your nieces or nephews or your father or uncles. This addiction epidemic is getting everybody. And I've said it before on this show, and I've been shocked. Maybe it's part of the age I'm at. Most of my contemporaries have kids that are either into their teens or early 20s. Now, I know 3 different people who have lost sons to overdoses. 3. One was with methadone. One was, methadone isn't necessarily safe, guys. It can be very dangerous if misapplied. And 2 more with drug, they call them poisonings. It's overdoses. And these were fine kids from stable families. They just, for whatever reason, got into the crap, and it led to the worst possible outcome. And we need to intervene. This is growing. This is getting bad. I shouldn't have to know 3 people who have had to suffer that. I wish I never knew anybody who had to suffer that. And it's growing. So with all that buildup, I'm going to bring in my guest. He knows a heck of a lot more on this subject than I do. And he's dedicated decades to helping people get out of that cycle addiction. That is, I'll just bring my scroll up here to make sure I don't mess it up. Dr. Dean Vause of the Alberta Adolescent Recovery Centre. So Dr. Vause, thank you very much for joining us today.
My pleasure.
So I guess, we've seen something of a turning point with this coming into the election. I mean, Premier Smith has talked about this issue a lot, and I've been happy to see that. But with her recent press conference, she's broached the issue, I guess, of imposing treatment upon people. But maybe I'll back up a bit before we get to that. You've worked of course, for decades in treating youth and treating people with addiction. And you've had a great deal of success stories. Like the fact that somebody who has received treatment is certainly much more likely to break free of addiction than somebody without. We'll start from there.
Yeah, thanks for having me and carrying this message. I came to Calgary 33 years ago, and I started on the reserves of Saskatchewan and Kamsack and the Cote Reserve, and had the highest suicide rate in Canada. I went and worked in the States, and I started my doctoral work out of Cincinnati. Was living in Vancouver, and I came here 33 years ago, and the research was not good about reaching youth. And that's what I speak to. I don't speak to adults, although we treat families, but I'll speak to the youth issue. That youth were dying. It was a pandemic, and I didn't know if we could really help these kids, because from the academic research and programs to reach these kids, they just weren't available. So I spent 5 years with an incredible doctoral team before we even got out of the chutes, developing our model. So 33 years later, came to believe, came to know that there's a solution and we can reach these kids. It's just like you said, the most agonizing thing I've ever faced is a parent losing their child. That includes, like, from the Cote Reserve. Today, Cote Reserve has the highest HIV rate in Canada. What's changed? Well, what's changed for us in Calgary and the kids we treat, we came to believe, came to know that we can help these kids. But it's tough, it's complex, it's the toughest thing I've ever done. But I want to tell you, it's also the best thing I've ever done. But it's labor intensive, it's high risk. And who wants to wade into these kids that don't want to stop, and they're dying? And so that's where I've spent 33 years seeking a solution to help those kids, 365, 24/7. It's a tough business, but majority of our kids, and I've sent this to you and I can show you this, is the research. Like when you talk about, I can have the anecdotal stuff, which is very powerful. I keep saying to my kids and parents, you not only have a message, you are the message. But to validate what we're doing, I've had to look at the legal aspects of it. I had to look at the clinical aspects. How do you deliver a program? How do you raise the money to keep it going? How do you access government support? It's very complex, but we've never varied, Cory, from our primary purpose of reaching that kid every day. And we came to know, we know how tough it is. We know it's high risk, but we know that we have a solution. So I can get going on this. But I think what Danielle Smith and Marshall Smith and these guys have done is given us a voice to share our message that there is a solution for these kids, but you got to raise the bottom. They are so sick. They are so mentally ill that they cannot stop. And there's nothing more painful than a parent watching their kid deteriorate in front of them, and it's hopeless. But to help them, that's what we work on every day, Cory.
Yeah, and it's a big long-term thing, and it's not simple. I mean, treatment for somebody when they're heavily addicted can take, I believe it was 3 to 8 months typically with what you guys offer, and sometimes the results you're looking at over 50% will stay clean. But some people say, well, boy, then half aren't making it. But I mean, it's far better than people who don't get treatment at all, and that's what people have to understand. That if left alone, the outlook for a person who's heavily into addiction is not good.
Well, I think, what's the success rate of these kids in 1989-90 was very, very low. It wasn't 50%. In fact, we know from our research, I had to go outside of the province to go to the Treatment Resource Institute, for instance, with Dr. Winters and Dr. Area to validate academically our program. Like you talked earlier about results. I'm into results. Otherwise, 33 years, I want success. My job is for that kid in the first chair who doesn't want help, that's really sick, that's addicted to drugs. I want to see results. So with our research, I've had to validate fight this in our own community and province to show academically that the majority of our kids stay clean and sober. That's ridiculous number. But I've had to go outside. I can provide that research. The other research, there's our research, Dr. Rinters, Dr. Area, which is published, that our average length of stay in treatment is 277 days. It's not rehab, it's habilitation of taking a kid and setting them up to win. Treat the addiction. We have a psychiatrist. We have multiple people that will help this kid. It's labor intensive. So we know that its average stay it's going to take time. So why do those kids stick around ARC? Why do those kids stick around for 277 days? Because they know they can win. Now, some don't, but the majority do. The other part, our research from Patton in 2004 and Winters and Urea, three studies say that 8 out of 10 kids that start the program finish. Now, that's 277 days. These kids are in treatment. Level 3 and 4, they go out to school, they go out to their community, we habilitate them. The number one predictor of success in the research of kids that are sober after treatment doing good in their life it's called retention. So 80%, we've got 2 major studies that say 80% of our kids complete treatment and have a better chance of making it out in life. And we're treating kids that nobody wants to treat, because we got to raise the bottom, because they can't see, they're so sick that they are killing themselves. So what's the option? Let them die?
Well,
and
that's
so I
it.
have a parent that says, yeah.
Oh, I'm sorry to interrupt, but yeah, and I've seen a couple of the commenters. It sounds like their children have gone through your program, and they really appreciate it. And they're using that term compassionate intervention, because that seems to be the part that some people are hung up on, is you have to intervene, even if the person initially perhaps isn't necessarily willing to go into treatment. They've had the parents intervening on their behalf or other loved ones, and you aid with that. And as you pointed out as well, it's a mental health issue. So, I mean, they're not necessarily making good choices initially. You need to stabilize their thinking. So
That's right.
Where you begin intervention?
Well, I think going back to this, parents have rights, and I'm talking about youth. And the issue is capacity. When they're mentally ill, the parent has a responsibility and the right to help them and protect them. And so legally, it comes down to capacity and a parent having rights here to save their kid. They've been everywhere by the time they get to me. They've been through the system. So where do you start? You start by talking to other people. I guess that's the best referral to me, is other parents that have gone through this, that have been shattered, that found hope, put their families back together. It's the same thing with my staff. I work with a team of miracles. They've all been through it. Now they're getting masters and getting educated. They know there's a solution. And so where do you start? Well, I've been there 33 years, Cory. There's nothing I haven't seen. There's nothing, the attacks, trying to access government support. What Danielle Smith is doing, I am astonished at her stepping in and having the courage to step in. And it is compassionate. These parents love their kids. That's compassion. It's compassion for us. We care about those kids. They will ultimately get better because they'll tell you they know we care. And it's in our simple actions of stepping into that disease with a solution. Hope is in human form at ARC. That's my whole staff of carrying that message. Not only the staff, but the parents that get its results. And that's what kept us alive over all these years. Now the government stepped up, which I think is incredible, to support us in helping, intervening with kids and raising the bottom and helping them get help when they don't want help because they can't see it. They're too sick.
Yeah. So something that unfortunately has gotten very politicized and we've really kind of polarized this, unfortunately, rather than just looking at results, is issues of safe supply or harm reduction. Like, I'm kind of on the fence with some of that. If an addict is dead, well, we can't help them. So if we could, keep them from dying on the street and hopefully get them into treatment soon, there's a role for harm reduction. But some people seem to see harm reduction as if it's an end, or that you can facilitate an ongoing addiction and it can be functional. And I think that's where the trouble starts beginning.
Well, I'm not against harm reduction, And you're looking at the continuum of care and the continuum of recovery. So certain people, if they don't have to come to ARC and they can cut down and not destroy their lives, I'm all for harmful reduction. But when you reach a point, and there's many, many kids, our research is showing, these kids have passed the stage of harmful reduction. They will use till they die. You step in front of their disease, it's going to be nasty because they're addicts. So ours is abstinence. I've been at this 35 years. I don't see any other solution for my kids. I've seen kids go back. Majority of our kids make it. Some go back out. They die because they start using again and they progress right back into the disease. So it's very difficult to treat them. But when you have the majority of the kids getting better, like I just had my gala, 31 years. How many of those kids are contributing to society? The best part of my job, Cory, to me, because I'm a senior citizen now, is watching my graduates be parents of their kids. And they're good parents and they're good people. And they know that they have a solution. So they're the best message I have. On the other part, I have had to look at the academic stuff. Our results speak for themselves. It's high-end, solid research from outside people. The other part is looking at the legal part. Parents have rights. Kids are sick. So that's the stuff that gets all thrown into the part of a kid that's so sick. They don't have the capacity, and a parent has, I believe, the right to step in and do what's going to help that kid or give him a chance anyway. That's what we're doing. We're giving them more than a chance. We're giving them hope, but it's hope in human form, because the kids that you may have seen or talked to, they'll tell you without an intervention, they're dead. So what do we got to lose, Cory?
Oh, absolutely.
It's well thought out. It's not just we're throwing this at you. It's 33 years of research and experience, and we have a message. Now we have a government, and I hope whether it's Danielle or Notley, come and support us, man. We're saving kids. It's not even a political issue. It's an addiction issue.
That's right. It shouldn't be. And as you pointed out, I mean, still, it's a very resource intensive. You guys have been fantastic with your gala and fundraising and things, but it's still never quite enough. I mean, and with a government, hopefully, that seems, no matter which government, more inclined to help fund these spaces, because that's what you need, and the resources and the professionals to help. It's so important. I mean, we shouldn't look at it as an expense. I think you look at it as an investment, because as you said, the payoff of sober grown children, we have a much better world for it all around. So I knew 15 minutes wouldn't be long enough. I know I'm going to have to talk to you again sometime down the road. Anytime. But you sent me some fantastic studies and statistics and documents. Where can they find those online, and where can they find your organization if they want to donate, or if perhaps they need help or anything like that?
Just look up Alberta Adolescent Recovery Centre. We have a website. Same thing with the research. I think that's very important, Cory, is the research of validating that this program, after 30 years, is showing pragmatic, real results. But that just allows me to go in there today, which we're doing, to carry the message and save kids. When we get people behind us, and I've never seen this in 30 years, what Danielle and the UCP are doing, and hopefully NDP, Notley, that can see that we have valid results academically, but most important is the families. If we did an economic study of all those kids that are out in the community, working, going to school, 30 years, it's a huge investment in our youth. But I want to just clarify, and I get going on this, but saving a life, there's nothing better. But this is tough, hard business. Those parents love their kids. They're committed to come walking in the door of ARC. And that's the model. We've created a unique model that's working. So now let's get out and carry it to other communities. Best thing we do is do what we're doing here today, carry the message. So thanks for having me. I appreciate it.
All right. Thank you very much, Dr. Vause, and for the work you do, and for sharing that with us. And I really do hope we get to talk again soon.
Thank you.
Great. So again, guys, that was, yes, Dr. Dean Vause of the Alberta Adolescent Recovery Centre. And, it's powerful, right? And as you can see, it's so much work. And I see a lot of the commenters, people have been looking forward to hearing from it. I mean, it's just such a good sign right there. You can see there's people who that center has helped. It's helped their children. It's helped them. Night Shift saying Dr. Vause saved his family. Tony Brady saying AARC saved my son and family. What a team. And that's the other thing, to be mentioned. There's a whole bunch of people involved in that, and what a tough job. I mean, it's like nurses in any other medical ward or doctors or health professionals. I mean, you have to be so strong to deal with when things don't go the way you want and still get up in the morning and get in there and keep working on it. And this is so worthwhile. Jamie Johnson, after 12 overdoses and multiple suicide attempts, my son's not talking about a future, including university. Thank you to the doc and his staff. Melody James, compassionate intervention saved my son's life. Dr. Vause and his team taught him and my family the way out. Like the comments are just coming and coming. And, Desiree Pressey, most of his staff have been through treatment and are living examples of what recovery looks like. And that's another thing. And that's what with a lot of recovery groups and organizations, it starts to become anecdotal. And sometimes you see the academics poo-pooing that or pushing it aside. But no, there's a reason you see things like, again, yes, I'm a member of Bill W.'s group. We're talking about groups where you can get together with other people who have suffered through the addiction you have, because that's how you can lend support to each other. Because somebody who hasn't endured that, while they might mean the absolute best and might have all sorts of things they can help, you can't beat having somebody who's directly known how to deal with that. It's very important. And every situation's a little different too. Some people have harder times, some people have easier times. It's just there's no cookie cutter approach, and you need as many all hands on deck. And Karen Mitchell saying rehabilitation is better than jail or the grave. And that's some of the stuff I wrote about before, because people talk about, when we're talking about intervention, whether it's adults or whether it's children, see, we've got to maintain the dignity of folks in addiction, and we can't infringe on their liberty. Well, when they've hit the streets, when it's gotten that bad, that far along, are they really at liberty anymore? No, they're a slave to their addiction. They don't have liberty. They can't think for themselves any longer. And, that's the path. Unfortunately, as Karen pointed out, if there's not an intervention or treatment or something, once it's hit that point, chances are they probably will end up either dead or in jail or in hospital. It's just bad all around. We've got to try and seeing successes. That's what we need to hear, and that's what we need to talk about. And this is results-based policy. This ties into what I was talking about with the ambulances and things like that. I just want to see what works. And Dr. Vause has shown a 30-year plan that works, not for everybody, but for the majority. We know what doesn't work, and that's facilitating, enabling, or sitting back and just letting it happen, because that's kind of what some people think is going to work. Kathy Terpstra, my 15-year-old daughter was in the depths of heavy drug use. I reached my bottom and found AARC. They taught my daughter how to live a sober life and how to live as well. I mean, that's part of it too. Again, I'm more familiar with the alcohol end of things, but you got to help the family. You got to help the loved ones. It's bigger than just the addict. There's Al-Anon you've probably heard of. Well, the reason for that is because it's not just the alcoholic who needs help. It's now the people who've been impacted by that alcoholism. It's a huge, overwhelming thing. And it does, though, lead to a payoff. Jolene Steenson, my mom put me into AARC at 17. I wanted to use drugs until I died. I'm grateful they stepped in front of me, even when I didn't want the help. Now I've been sober for 10 years and I'm in university. See, we all win. If you want to be a cold, calculating, true conservative like they talk about, oh, you're just the heartless, you're just looking at the dollars and bottom line. Fine. Look at it that way. Let us be that way. We are already spending a whole pile of money on untreated addicts because they're in the health system. They are in the social services system. They're in the prison system. They're in our mental health facilities. So you're already paying. So let's pay to have people recover. Let's pay to have them out and feeling better and living and being happy and having a job and paying taxes and putting back in. But they've got to have help, and you've got to have intervention. So it's been so good. I mean, again, I know, I run an opinion show, so I'm biased, but I mean, I don't care who does it. I want to see recovery in this. And if Premier Smith brings that in successfully, really brings it along, we're all going to win with that, because we haven't seen a premier, I'll credit Jason Kenney with some of it. he started talking about expanding treatment spaces, and nobody really had been talking about that much. And when he was finished, they'd been up to 8,000 spaces available. BC only had, I believe, 3,600, and that's a province with more people and definitely a much more acute addiction problem going on than ours. And we've got more treatment ability. Last January, Alberta actually saw a reduction in overdoses. No other province could say that. Everywhere else, this is a problem. It's growing. And that's because we've had more treatment ability, but we still need more. I mean, you only have to go out in the streets, ride a train, or talk to friends, family, and loved ones, because everybody seems to know somebody who's in this condition who needs to be helped, who needs to be fixed up. So, Dora, I'll finish the comments and get on to more subjects here. Dora Moali, I'm so sorry. I'm so awful with names. There's where I need an intervention. People got to teach me how to pronounce names. Said AARC saved 2 of my kids, saved our family and my marriage. If not for AARC, my kids would be dead. And there, as Dora said as well, not just the kids, but the marriage and the family. This is big. This is big. This tears families apart. This can be terrible. So I'm just glad to see the message of positivity and hear so many success stories. I know there's a lot of stories that unfortunately didn't lead to a success. Something I've talked about on the show as well. I mean, I went through recently, because of course we're getting a lot of the experts. Experts. You put that in quotes whenever you talk about it. Talking about intervention and saying you can't force somebody against their will. Well, under the Alberta Mental Health Act and every other province, so we're getting onto the adult stage of it, perhaps. I mean, it's different with a minor because the parents, as Dr. Vause pointed out, have some rights and they can intervene. With an adult, you don't quite have those rights. But under the Mental Health Act, I had to have a family member committed about a month ago. I've talked about that on the show. And it's a process, and it's not easy, nor should it be. You don't want somebody frivolously committed, not by any means. If they haven't committed a crime, you don't want them restrained. But if it's evident they're going to harm themselves or others, that's where the bar is. Then for their sake and everybody's sake, we have to take them in and try and help and deal with this. That applies with addicts in the late stages. If we can do this with somebody who's schizophrenia has gone out of control, or a bipolar disorder, well, if they're heavily addicted to fentanyl or methamphetamines or something like that, I don't see why it's unreasonable to say this person's going to harm themselves or others, and we have to take them in to try and deal with it. That's not an unreasonable ask. I understand some people, I have a large libertarian audience who very much don't like to see people's liberties infringed upon. Of course not. I don't want to see it either. It's a last resort. But we have to have that last resort. And, because otherwise the path is bad. All right, so I'm going to turn pages on this. We're going to talk about this more, of course. It's always been a subject that's been big with me, and we'll certainly follow up more. And I really hope to see more success and more discussion of it. I really hope to see the NDP just starting to look at things such as the numbers from Dr. Vause, the press conference that Premier Notley did with chiefs from First Nations, with recovered addicts, people like that, to show this can be a success, and have Notley say, yes, we can do the same thing. And they're campaigning, they can say, we can do it better. Okay, good. Just as long as somebody's doing it. I don't care who does it. I really don't. So let's just keep pushing on that, guys. Even if you don't like the current government, fine, then push the other party to push more onto a treatment-based thing. All right. Let's see. I got to cool things down, maybe, or at least in a different way. It still gets the blood pressure up. Let's go through some news items before we get on to the agricultural check-in and stuff like that, because as we can see, I could go on about this, and there's lots to go on about for a while. So Governor General Mary Simon, yes, boy, speaking of money that can be better invested elsewhere, she billed $38,000 for her wardrobe in the last 16 months. Yes, clothing. Again, we got addiction centers that need money, but we're giving our Governor General $38,000 for silk jackets, cocktail dresses, accessories. Her salary is $342,000 to be Canada's chief ribbon cutter, because she's just a ceremonial position. That's it. And she can't buy her own bloody clothes. She gets a free house, she gets free travel, and while she travels, she spends $90,000 for food catering for her and her entourage on a one-week trip. I wish I was making those numbers up. And she's also dinging us $38,000 for clothing. Yes, we should be upset. There are better things to spend our money on. This country is a mess. Speaking of people's wasting money, then, let's look at our finance minister, Chrystia Freeland. People watching the federal scene have seen there's been the budgets being pushed through, the filibustering that's going on. There's people, the Conservatives are trying to hold it up because it's a massive spending budget yet again. Freeland testified for 90 minutes at the Finance Committee to try and break the filibuster. But she says the debt charges are absolutely handleable. We've got over $1 trillion in debt now. So we're talking 50, I believe, getting close to 50 billion a year. We're going to spend just on interest. We're running out of money for very important things. I'll throw another commenter in there, Tom Muskia. I'm probably ruining your name again. Sorry, Tom. But thank you for commenting, saying, yay, RC, save my kids' lives. It's a huge commitment, but a small price to pay to save my kids' lives. See, we have money in this country. We have resources. But we're letting our inept or indifferent, wasteful politicians piss that money away on things like outfits for the Governor General, or just borrowing and throwing money blindly at programs or subsidizing things while we spend, again, we're going to get up to $50 billion a year on interest payments. Imagine what we could do for our country with that $50 billion then. Let's look at it. We're going to talk about, again, addiction and mental health. That would be $5 billion a year you could give to every province in the country just to spend on addiction and mental health. Could you imagine how positively that would impact crime rates, healthcare rates, tourism even? Seriously. Downtowns and cities across Canada right now, you can't go into them. In Toronto, the Stabathon on public transit is unbelievable. Likewise in Calgary, Edmonton, Vancouver. $50 billion a year, though, we're flushing on interest. There's one of those cognitive dissonance things I see with socialists that don't seem to understand. They hate big business. They can't stand seeing corporate institutions making money out of the taxpayers, but they don't have a problem spending $50 billion in interest. Well, who do you think that interest is going to, guys? Small business? You think it's the mom and pop government lender down the road? No. That $50 billion is going into the pockets of big money folks, guys. So quit borrowing, quit spending on stupid things, such as the Governor General's little trips and wardrobe. Easier said than done. I don't know. We let politicians buy our love. We're seeing that in Alberta. And to be fair, one of the areas that, Premier Smith has been getting a lot of critique from, and I'm critical of it as well, of course, is they're doing the usual thing of campaigning and just promising, spending, buying our love. It's our fault. We respond to it. The reason they do that is we vote for whoever's going to blow the most sunshine up our keisters and whoever's going to spend the most on it. So, of course, our budgets get unsustainable, and Premier Smith's budget hasn't been looking terribly conservative by a lot of measures, and we still got another 10 days left. So if we want to see more conservatives, I think we're going to have to get better at it, aren't we? Here's another beauty, with our programs. It shows the inefficiency of them. The Canada Greener Homes Grant. This is one, we're going to make everybody green. And let's see, this one's supposed to support 700,000 homeowners with grants for retrofits. Make your place a little greener, save a little on energy. Well, if it's free money, if it's $5,000 each, whether you like it or not, most people say, yeah, I'll go in for that. But somehow, even though they launched this thing 2 years ago, only 41% of the target ever actually applied for it. And, of those, so 287,000 applied and only 60,000 qualified. But we're talking about these numbers. They were looking to support up to 700,000 people with $5,000 each. This is a lot of money for a program that doesn't appear to be doing a damn thing, except for employing thousands and thousands of pointy-headed bureaucrats who get a heck of a lot of money to keep talking about this and moving paper from here to there and there to here, whilst not actually getting any decent outcomes or results from it. So, we've got money to spare, guys. We just need to spend it better. But again, if my aunt had testicles, she'd be my uncle, right? You can wish for things, but it doesn't necessarily mean they come about. But we'll keep pushing and keep hoping for some responsible things. Okay, let's pivot a little. I've been ranting quite a bit for a while. Let my blood pressure come down a little bit and check in with Jim Buzicum and see what's happening out on the agricultural front. Hey, Jim, how you doing?
Hey, doing great. How are you doing today, Cory?
Oh, pretty good, actually. I had a fantastic interview just earlier, kind of hard subjects, but very worthwhile.
Good. There's always lots to cover, isn't there?
That there is. So your area of coverage is the agricultural world and trying to track those geopolitical issues and impact prices.
Yeah, so we'll start there today. So on the ag side, especially with the wheat trade, the news is that Russia has renewed their grain corridor that will continue to allow Ukraine to export through the Black Sea region. So the result of that this morning is markets have definitely moved lower. We had a move of 15-20 cents per bushel US lower on the wheat market. This follows days of uncertainty where there was actually a lot of chop in the markets, some fairly good increases as well, because there was, again, that, and really still is, there's still that uneasiness of what's actually going to be able to ship out of those regions. So, so there's some speculation about whether, or why Russia does this, but, really, the wheat's probably going to come out of that region one way or another. There's plenty of buyers looking for wheat across the world, and they're buying it from Ukraine, they're buying it from Russia, they're buying it from Canada. It's really a price-sensitive market. Now, furthermore, if we take a look at the weather markets that have shaped up here, we're at the start of a growing season. Farmers have finished planting their crops or just busy finishing right now. And as you notice, looking out the window, it's a little hot and dry and a little bit smoky in the air. So certainly with it, farmers are worried about moisture conditions, the ability to grow a crop if it stays dry. Right now, it's still early enough on the calendar. It's only May 17th. 2 weeks from now, 3 weeks from now, if it's still dry, I hope it's not smoky in 2-3 weeks from now, but it'll certainly look a lot different on grain production if we move into June, especially middle of June, without any significant moisture. Then we would be certainly talking drought.
Well, I guess, weather's one of the things you watch for, but as you're kind of saying, don't quite sweat it yet. It's still pretty early, and that might turn around yet in the next few weeks.
Absolutely. Yeah, that's it. We tend to, especially on the farm side, we tend to forecast what will happen if weather stays dry rather than what it's doing today. Right now, it's actually still fine. Everything's looking pretty good as far as Western Canada goes.
Great. Well, thank you very much for the update this week, and we look forward to talking to you again to see what's happening on the markets next week.
100%. Thanks, Cory. Take care.
Great. Thanks.
Yeah, bye-bye.
Jim Buzikum of Marketplace Commodities, guys. Check them out, marketplacecommodities.com, and get more detail on all those important issues with your ag business. Let's get on to a few more news items before I wrap things up quickly. I want to talk a little more on the provincial stuff. Some we've been seeing. We're going to talk a little bit about, by the way, the Pipeline is our show that comes on a little later on Wednesday nights as well and gets done. The polls, the Alberta election, boy, the polls, they're all over the map. They are, including even one the Western Standard was involved in. But we got some polls saying it's a NDP leading by 8 points. We've got some polls saying the UCP is leading by 7 or 8 points. I honestly don't know what to believe. Polls, we always love to wrap ourselves around the ones we like and then dismiss the ones we don't. I'm trying to dismiss the whole works because, when you see basically, if you take the outliers on each edge of what's gone on with these polls, you're seeing as much as a 14, 15 point spread. Well, somebody is pretty bloody wrong, aren't they? But we make so many news stories about these polls and try and read into it. We want to. The polls are important. You want to speculate. You want to see what's working, what's not working, I guess, for campaigns and what's moving along. But, man, they are something else. And I worked on 2 different campaigns in the old days of the Wild Rose Party when I was managing a couple of campaigns in 2012 and 2015. Both times the polls showed in the ones I was working on leading by a whole pile for the Wild Rose. We're doing great. Election day came, we got slaughtered. The municipal polls, I believe those years were terrible too. They weren't worth a crap. So we'll still keep talking about them. We report on them, but boy, we just can't rely on them. You see them bouncing around, you see them wrong, but often they're all kind of wrong the same way consistently, so they'll all be saying, oh, such and such party is going to win by this amount. And then the election comes on. It turns out almost all of them were totally wrong. In this case, though, they're bouncing around like ping pong balls and they're giving different numbers all over the place. So I don't know who might be doing, winning and whatnot. Charlie Bow is saying polls mean nothing. Those Dominion voting machines are going to mean everything. Yeah, well, they're not using those in Alberta. But as he said, please vote in person. It's a good idea. Get in there, get in and vote. Put your ballot in. Speaking of that, I was listening to there's an NDP. I won't even name them. Just basically a blog that gets a lot of money from the NDP and the Broadband Institute, and they call themselves a media outlet. They've been going on about. I mean, the conspiracy theories. The conspiracies are now really coming from the left these days, and there's a group that was out there pushing for using scrutineers. They were holding webinars talking about how to scrutineer during elections. For people not familiar with it, volunteers go in. You can go in. I've talked about it, I believe, on this show before. If you're with a party, you can register. You can go in the morning when they open up the ballot box, show you it's empty, tape it shut. You can be there to watch every vote all day. You can put people in on shifts, and then you can be there the whole time when the boxes are reopened and those votes are counted. It's actually a very good system. And it allows you to go in and see with your own eyes whether things have looked questionable, aren't questionable. You can ask things. You can, you can't get in people's ways. You can't intimidate or anything like that. But you can be there to supervise. And it's a very important part of the democracy. None of that counting should happen behind closed doors or without you being able to, supervise that. But we don't necessarily get out and do it. So perhaps if there is misdoing or misdeeds in the elections, well, it's happening because we have to take part. And Charlie's saying those need to be reinstated at every polling station. Yeah, the scrutineers are still there. They can be. It's just up to you. But this is reported on by Press Progress. Like, this is a conspiracy. This is bad. These guys are tied in with election conspiracy theories. They're not good. No, they aren't. They're just telling people to go out there and take part in the process. And it reminds me again of the conspiracies being spread about Take Back Alberta in Alberta. They've been doing their thing, getting on the ground, holding their meetings. And David Parker runs that. He's more socially conservative than my tastes land. But what I'm impressed with is his message isn't about his views in social conservatism. It's just saying, get off your butt, use the process, get out there and do it. He's not asking about anything secretive or untoward. And that's what's got them scared, though. You see, the establishment thrives on our apathy. It makes it by us, due to us sitting on our butts, due to us being indifferent, due to us not getting out there and taking part in the parties or taking part in things like scrutineering during an election. So, when Parker says, hey, get out there and take part in the nominations, get out there and take part in the electing the board of your party or your school board or things like that, why is that controversial? I'd be scared of the person who says that's controversial. Why do you thrive on people not using the democratic tools at their disposal? That scares me. So either way, that's the latest conspiracy. Oh, my Lord, scrutineers are somehow going to screw up the process. Sorry, guys. No, scrutineers are an integral part of the democratic process. Okay, well, there'll be lots more coming, guys, and lots more coverage. By the way, there's going to be coverage of the debate starting tomorrow at the Western Standard at 5:40 for those of you guys watching live. It's going to be special coverage covering all of that. Don't forget election night, too. We've got a huge thing going on. I got another show before that happens, but tune in here. Don't waste your time on CBC and all those other outlets. We'll have it here in full and give you good coverage of the whole thing. Don Sharp saying, is the NDP going to force paramedics back into the hallway because the United Nurses Association is complaining about having to work? Yeah, probably if they get the chance. So let's not give them the chance. Okay, everybody, that was a really packed show. Thank you. And thank you for all that feedback. It was really good, guys. I like those questions. Keep them coming every show. I will be back again next week at this time with a whole pile of news stories, another guest, and of course, lots more issues to discuss. So thanks for tuning in, guys, and I'll see you in a week.
Here's an update on commodity prices in Lethbridge for today. Cash barley is steady at $4.07, feed wheat remains at $4.08, and corn is down $2 at $3.88 per metric ton. In the milling wheat markets, July Minneapolis futures are lower 10 3/4 cents at $8.68 per bushel, with local hard red spring bid for May movement at $10.30 per bushel. Looking at canola, nearby futures slip 10.20 at $7.19 per ton, with delivered values for May movement at $16.08 per bushel. In the pulse markets, nearby red lentil prices are trading at 34 cents per pound, and yellow peas are lower 25 cents at $11.25 per bushel. And in the cattle markets, June live cattle are up 85 cents at $164.73 per hundredweight. For more information on pricing or picked up options, give me a call at 403-394-1414 1711. I'm Matt Busicum at Marketplace Commodities. Accurate, real-time marketing information and pricing options.
Canadian Shooting Sports Association. Without the CSSA, our gun rights would have been taken long ago. These guys are on the front lines helping to draft smart and intelligent firearms regulations and legislation in Canada, and more importantly, educating the public about how we keep guns out of the hands of the wrong people. We've become a member. It's absolutely worth every penny.